So the purpose of the Action Collaborative is to bring expertise from all of the fields of health science and to bring communities to be able to lend their knowledge on how we can develop a systems approach taking into consideration real human experience to make health science better.
Our communities are the data, so we are the lived data. Our culture, our knowledge, our language, our stories, those are data.
And it's interesting how we feel like we can do all our science, all our policies from ivory towers and places far removed from the people that it stands to impact. And what this collaborative does that's different from a lot of them is it takes it right to the people.
So that we're building trust with the community in science together. And hopefully that future is a new future to come that started really with this work.
I feel like I represent my family, and they didn't have a seat at the table when it come to healthcare. And so I thought it was important that I had a duty and an obligation to speak for those who couldn't speak.
We are the people. We are recipients of public health, not just the creators, not just the facilitators. We receive this too. We are not separate.
As a nurse, I look back on these experiences and I am wounded, but I will always do my best to make sure no one else has to have a similar experience.
Because maybe trust isn't about blind belief, and maybe questioning isn't about rejection. Maybe the real trust is built when people feel invited in, not talked down to.
So I was raised in an anti-science, anti-vaccine household, so I really want to do this kind of work in general because I want to be able to reach people like I grew up with, because I see the harm that's caused because they don't trust science and medicine.
There's extreme distrust in health science because there's been historical injustices and harms that have caused so many communities to not trust. So it's sort of this really strange circle of disinformation that we're hoping that we can tackle.
So being a medical educator, I can tell you that medical students go into medicine for all the right reasons. However, the system is the one that teaches them all the isms.
It's vitally important that our voices be heard and that the medical community begin to take what we think and feel into consideration.
Public health and healthcare have to individually and collectively decide, are we truly about helping people? I'm in the hallowed halls of the National Academy of Science, so now I get my chance to shape this field in the way that I think is more inclusive, more welcoming of how health and well-being shows up for all the people.
Hopefully, these are the beginning conversations to shift mindsets and then shift systems.
Trust isn't built through information, right? It's relational and it's intentional, especially when we talk about communities.
Why wouldn't we want to build trust with them, derived with them, so that when they experience these systems, they feel trust?